Good morning or good evening, everyone, depending on where you're calling from. Bina, do you think we're ready to get started? UNICEF Thailand, are we ready in Ministry of Health? We need a few more
Can you hear
minutes.
us?
Yes. There's a slight echo, so I would just say if you're not speaking directly, to put your mic on
ตอนนี้
mute.
ครบแล้วนะคะขาดกลุ่มคุณเอเข้ากลุ่มเลย One นะคะ second.
So especially at least when the presentation is starting, to just put your microphone on mute, okay? Because there's a slight noise coming from someone's mic, but other than that, I think it's quite clear.
Jessica, can you hear me now?
Yes.
And I'm going to mute, so I just wanted to.
Okay. Hello?
I just was checking my mute. So
Okay,
yeah,
great. Yeah, it's working. Okay. So thank you everyone for joining us today as we are honored to have a presentation on Thailand's journey and experience in achieving the elimination of mother-to-child transmission of HIV and syphilis, which occurred on June 7, 2016. Thailand was the first country in Asia and the first with a large HIV epidemic to reach this remarkable achievement. And we are privileged and honored to have the Ministry of Health here with us to share firsthand their experience and lessons learned. Before we start, just a brief overview of some housekeeping issues. That is to kindly place your mics on mute while you're not speaking. And if you're having problems hearing, please feel free to type in and I will guide you through how you might be able to troubleshoot that. We will have a brief overview to set the stage and frame the presentation, and then the presentation from the Ministry of Health in Thailand, and then followed by a question and answer session. And then we will show a brief video in the end to wrap up the webinar. And again, we're very grateful for the effort that everyone's made to join early in the morning in Thailand or in Asia, and late in the evening if you're on US time or in the Americas. So thank you very much. And without further ado, I'll hand it over to my colleague Kutiparamibo Bina, who is the chief of the HIV section in UNICEF Thailand. So over to you, Bina.
Thank you, Jessica. Greetings to all from Thailand. Can you hear me? Am I audible? Yeah, no, I don't know about Jessica.
Yes.
Yeah. Can you hear me, Jessica? Just to cross-check.
And our participants are responding to that you're clear. Mm-hmm.
Okay. Thank you. Greetings again from Thailand. I was just recollecting closer to this time last year. Many of us in Thailand felt like we were preparing for a major university examination. I'm sure others who are also connected now and who went through this experience in Thailand know how we felt during the preparation for validation and the actual process of EMTCT validation. For us, in the region and maybe globally, why this is very important is that, as Jessica said, Thailand in 2016 became the first country in Asia and Pacific region to be validated for EMTCT of HIV and syphilis. This is also the first country with large HIV epidemic to receive the validation from WHO. And of course, a movement towards ending HIV/AIDS globally, and of course having an AIDS-free generation. When we say AIDS-free generation, I just want to bring it to your attention, the overall context why we are talking today. It is significant because in 2008, Thailand mother-to-child transmission was around 5%. And in 7 years, we reached less than 2%. That is where it becomes significant. And of course, there are 3 key factors I would like to highlight before we move on. One is the success is due to strong leadership and political commitment, which was demonstrated by the Royal Thai government, and they really put a big force behind strengthening health infrastructure and systems. So Thailand has a universal and inclusive healthcare system. And of course, the country has a strong willingness to address issues head on. They leverage various partners in this process, national, international, and NGOs, and of course grassroots level partners. WHO, CDC, UNAIDS, and UNICEF were other significant international partners in this. Thailand always moved quickly to adopt global guidelines. I think this is something which I really want to highlight. And of course, Thailand has always set its goals higher than the global goals so that we could strive much more stronger towards the goal. And now we are in a place where we need to sustain the EMTCT. To sustain this, the country will have to continue to provide high quality and inclusive services that encourage all women living in Thailand to access early ANC and HIV service. It's also important to note that currently we have almost 450,000 people living with HIV in the country. And of course, there is a significant pocket and population which is at high risk of contracting HIV. This includes adolescents. There is good number of teenage pregnancies still we are tackling. There are men who have sex with men, the younger MSM population who are still highly infected. So it's important for Thailand to continue focusing on HIV prevention, early diagnosis and treatment for this high-risk population. So put together, I'm sure we are moving towards an AIDS-free generation. I like to conclude by saying that Thailand has made the significant stride to end AIDS or moving towards ending AIDS, because in 2000 we were talking about an estimated 1,000 children who were getting HIV infected, and in 2015 that is reduced just to 85. This is where we are. The journey has been very inspirational. I hope today's discussion will inspire more countries across the world as much as it inspired us in Thailand to see reaching the finishing line and sustaining it. Thank you very much. And with this, I am going to be inviting Dr. Sarawut, the Director of Regional Health Promotion Center, and who played significant role in Thailand's success in the EMTCT. And of course, we have Dr. Rangsima from CDC, Dr. Chavivan from Ministry of Public Health also in the panel. So now it's over to Dr. Sarawut for the presentation. Thank you.
Bina and Jessica. Good morning and good evening, everyone. On behalf of the National EMTCT Validation Committee and the Network Group, it's only for the Ministry of the Public Health, because many organizations to help Thailand for achieve the target of the WHO. And today, I would like to share about the experience. The next slide. I would like to share the experience about Thailand, the performance of the PMTCT program in Thailand. The next slide. Slide ถัดไปครับ and overview of PMTCT of HIV and syphilis program in Thailand, and role and responsibility of Ministry of the Public Health and also at national and subnational level, and how the program is resources and monitored and the main challenges and the way forward in Thailand. The next slide. This slide shows about the HIV EMTCT rate report by GAF in the during year for the validation. The indicator data from Health Information System show that by the end of 2015, and Thailand had achieved elimination of mother-to-child transmission of HIV and syphilis. You can see the blue line, the data from the national adjusted MTCT rate. And the red line is the data from the spectrum version 5.4. And the mother-to-child HIV transmission rate declined significantly from 10.3% in 10 years ago and to 2% in 2014 and 1.9% in 2015. From the during period for the validation, the data declined. And the data of the spectrum version 5.4 show that the MTCT of HIV rate declined from 2.3% in year 2013 to 2% in year 2014 and 1.9% in year 2015 is the data for the main target for achieve the validation. And the next slide. And about the congenital syphilis is the annual rate of the congenital syphilis and new pediatric HIV infection. The data from the Bureau of Epidemiology and the new pediatric HIV infection decline. And for the rate of the congenital syphilis stood at 11.2 cases per 100,000 live births in 2014 and 1.9 in 2015. This result were achieved through a nationwide systemic effort that result in sustained quality service and high level of service coverage and intensive adherence. The next slide. I would like to talk about health service delivery system in Thailand. I think this system is important for Thailand achieve the target of WHO. Very long time in Thailand have the good system for the health service. Thailand has a strong health system able to deliver quality service all over the country, including to the most remote, hard-to-reach areas. The public health program is implemented with the participation of community, family, and individuals. With support from the primary care network. I think the primary care network is important in Thailand because of the Thailand is a developed country. Not only for the big city can implement some project, but in the rural area and the primary care network is important. And the community-based care is linked with all the levels of the health system. And Thailand health system includes public facility and private hospital. There are 3 levels of management of public facility under the Ministry of the Public Health: primary, secondary, and tertiary, which an appropriate division of labor and referral protocol. I think it's important because in the community and in the rural area, not the specific doctor to care and management when all of them have the problem in the community. But we have the protocol, I mean that about the standard protocol and referral system to support about the system. And public health facilities outside the Ministry of the Public Health are managed by other government ministry. Besides of the government, we have the private sector to collaboration with the government sector for implement about the HIV and syphilis project in Thailand. The next slide. About this slide show about the coverage of the HIV testing and ARV among Thai and non-Thai pregnant women and their baby in Thailand during the year for the validation period. About the perinatal HIV intervention monitoring system is a robust EMTCT monitoring system coverage about the more than 90% of the government hospital in Thailand and around effective monitoring of the situation, the disease response and the health outcome. Maternal and child health is an integral part of the national health system. The coverage of the HIV testing, maternal and infant ART for PMTCT were high among Thai and non-Thai based on PIM data. The performance achieved EMTCT target profit indicator. In Thailand, we have the monitoring and evaluation system. We use the PIM program and the NAP program for the monitoring and evaluation. It is important for supervise and monitoring about the system. The next slide. This slide shows about the coverage of the syphilis testing and syphilis treatment among Thai and non-Thai pregnant women in Thailand. In year 2014, the PIM began to include data and syphilis in pregnant women. The data show that about nearly 100% or 99% of those women received the syphilis screening and found about the 0.06% were found to be syphilis positive. Of these cases, about the coverage was largely similar for both Thai in green and non-Thai women in orange. In Thailand, about for the ANC screening, we have to check anti-HIV and VDRL and hepatitis B screening and thalassemia screening is like the standard for the ANC screening. You see a system in Thailand. And the next slide. The coverage of the HIV testing, ART and CD4 testing pregnant women in PIM program and non-reporting unit, in some hospital, especially for the private hospital, cannot to release or submit the data into the program. But Thailand, we have the survey for non-reporting unit. It's like the hospital outside Ministry of the Public Health, like university hospital and private hospital. We conduct a special survey to PIM non-reporting hospital. The questionnaire survey was sent to 170 hospitals, including about 140 private hospitals, and response rate about nearly 40% in year 2013 and 35% in year 2014 and 8% in year 2015. The coverage of the service were high and achieved EMTCT targets similar to PIM reporting hospital. The survey is we survey for the every 2 years, but during time for the validation period, we survey for the one time for show to the committee for the validation. The next slide. Thailand is among the first countries globally to introduce a system-wide initiative to reduce HIV-related stigma in healthcare setting. Stigma reduction in MCH and ANC productive health facility is prioritized. Although high stigma on sexual reproductive health from the IHPP survey in the past, the data show good progress and reducing stigma and discrimination during the past year. I think all of you know about the target of the validations. The first one is the transmission rate of HIV, mother to child HIV transmission, and the second one is the syphilis, congenital syphilis, and the third one is stigma and discrimination in Thailand. Have the committee for maturing about the system, about the stigma and discrimination. The next slide. This slide is important in Thailand because of partnership is important for the EMTCT of the HIV and syphilis, not only for the Ministry of the Public Health. The Ministry of the Public Health is like the focal point for the work together with another organization. The organization of the government is like the Ministry of the Public Health. Many the department in NOPH can work together, and those factors are the national ownership and the leadership, sustained political commitment, a favorable legal and policy environment, as shown in this slide, and many organizations, including university, research center, international organizations like CDC Thailand, UNICEF, UNFPA, and Thai Red Cross and NGO. I think that's important. Many organizations support about the budget. Is like to management for the budgets in Thailand, and civil society organization to work together. And the next slide. I think all of you know about the financing of Thai healthcare system. You know about the 30 baht scheme in Thailand. I mean that's about the for Thai citizens not pay anything in Thai in Thai services system. And the public health facility are financing from the national budget. The service-related expenditure are borne by the National Health Insurance Scheme, including UC and civil servants, medical benefit, Social Security Office, and commercial insurance company and self-payment. And for non-Thai citizen, service-related expenditure can be covered via the health insurance for migrant policy, and hospital social welfare and the special project from Princess Somsavali PMTCT fund provide support for PMTCT drug and lab testing for migrant to Department of Health. The next slide. But Thailand is applying the WHO four-prong model to the implementation of PMTCT, starting with primary HIV prevention among women of reproductive age. Sexual health education is delivered in all schools. And Thailand has many organizations to join and support about the four-prong. And especially if we found HIV positive women that become pregnant, then the objective is to prevent MPCT and to care for the mother and family member until delivery. And in Thailand, syphilis and HIV screening is I told you of you in the first slide has been part of the routine ANC service for the pregnant women. If found to have syphilis or HIV, the woman and her partner and infant receive treatment in the routine healthcare system, and many partners have involved in implementation of the four-prong model, as shown in this slide. The next slide. This slide is Thailand National PMTCT policy evolution. Many years ago, I think Thailand have the policy for improve about the program. The guidelines start in year 2000 for all government hospitals to integrate PMTCT of HIV into the routine MCS service, including VCT for the HIV and screening for syphilis and hepatitis B infection among pregnant women. ARV regimen have been changed periodically according to the evolution of the prevention of transmission starting from the single AZT starting at the 34-week gestation for the HIV positive mother and for her infant starting at birth for a period of 4 weeks in year 2000. And we continue lifelong ART for all HIV positive pregnant women. It's like the WHO option B passed in year 2014. And in this year, we have the new project. It's like the it's like early diagnosis in pregnant women and early diagnosis in baby at birth by PCR. And if we know a high risk mother and high risk infant, we can give the ARV to the baby for prevention and treatment. The next slide. About the surveillance and monitoring system, including PIM and NAP program, clinical and healthcare data bank of the Health Data Center of the Bureau of Policy and Strategy of the Operational Plan, Ministry of the Public Health and Passive Surveillance System implemented by DDC, Ministry of the Public Health and Bureau of Epidemiology around effective monitoring of the situation. The disease response and the health outcome. Maternal and child health is an integral part of the national health system, especially for PIM. I think it's important. And we can correct the non-reporting hospital by survey. I think it's important for the monitoring in some gap of the system. The next one. About the challenge in Thailand, remaining cost for the EMTCT in Thailand from this data, ACC data, we found although Thailand achieved the target, we aim to further reduce EMTCT rate to less than 1% in year 2030. This is our target in Thailand. I think it's an important challenge. Remaining cost for the MTCT based on the ACC data show that about the 81% of HIV infants were born too late presented and poor ARV activate in mother. And about the 7% were from mother who has zero convert during delivery, and few percent were from the health system error. To address this challenge, I think it's important to empowering individuals to know their HIV and syphilis status and to engage in a timely manner for late presenter Thailand National PMDC guideline in year 2016. In this year, we include Leuticavir. Leuticavir is I think it's important to late presenter implemented by Thai Red Cross and Department of Health to implement for late presenter pregnancy women. I think it's important. But I think I not national policy in this time. But maybe the next year we have to discuss about the result of Leuticavir again. And active case management for individual client is also important to serve need to each patient. The next slide. The last slide for the conclusion about the success and sustainability of the EMTCT of HIV and syphilis in Thailand. The first one, I think, national ownership and leadership for the EMTCT. And the second important, I think, the partnership collaboration. I think it's important. And sustain political commitment. In Thailand, change about the leader of the government for in that time. But for the policy, not change for PMPCT. I think it's important. And our able legal and policy environment is important too. And those factors are national ownership is important. I talked to in the first one. And about the policy from the center to the community is important, especially for the leader in the community. It's like the enhancement of the community system and the strengthening of the community interface with the health system is important. The last one. Okay. I acknowledgement and thank you very much to every body and every organization to support Thailand, especially CDC Thailand, Dr. Laksima, and CDC and NGO and many I cannot to talk in that detail. You can see indeed that this slide and thank you very much. I think Thailand is experience in the first country in Asians, but we have something to do for work to sustainability in the future, and I think we have to learn more about from another country to improve about the program. Thank you very much.
Thank you, Dr. Sarawut, and for being so generous with your time and sharing the experience in Thailand and achieving EMTCT of HIV as well as the elimination of syphilis. I think highlighting briefly some of the issues that you discussed, from my knowledge, other regions also are experiencing or experienced some challenge addressing, which you mentioned, such as stigma reduction in health facilities, being inclusive in terms of providing access for all, and also addressing primary prevention, which for many countries who may have achieved the criteria for mother-to-child transmission rates have not achieved a case rate, maybe because there are still many new cases and the absolute numbers of cases remain quite high. So Thailand has been able to address some of those challenges, which I'm sure other countries will be able to learn from. And some of the remaining challenges you highlighted in terms of late presenters and poor adherence, seroconversion during pregnancy, and silent transfers between hospitals, those are also challenges that many countries and other regions experience. So I'm sure that the lessons you've shared are quite applicable, and we hope that we have some exchange in the next few minutes. And we have some questions coming in from Monique James, and she asks, what role, if any, did the community systems and the community in general play in addressing or improving ARV adherence? And did community systems also make a measurable contribution to demand creation? Or is testing already at such high levels due to the strength of the national health system?
Yeah. Thank you very much for about the question. I would like to chat to you about the system for the monitoring and evaluation system. In Thailand, we have Health Promotion Center. It's like the MCH board, located in the regions. We have the 13 regions in Thailand for monitoring and evaluation. For supervise the is like project manager in the province, and project manager the province have the healthcare worker in the community uh, for take care and supervise in the community. And when we found it's like the poor adherent or high risk pregnancy women can send the data into it's like the Google Map in that lead time can show the risk pregnant women in every area in the country. I can show to you about the Google Map in the later for the monitoring and supervision. About the policy from the central, we have the it's like ผู้ตรวจราชการ supervision doctor supervision in the regions monitoring the KPI is like the KPI for the monitoring the province for the adherence and for the pregnant HIV positive receive the ARV. I think it's important. And I think Dr. Isma can share about this patient.
Hi, good morning. Rang Simon from USCDC office in Thailand. Can you hear me? Okay,
Yes.
so I'd like to share further questions regarding community health workers and any whether community has played roles for contribution for antiretroviral adherence or contribution for testing for the PMTCT coverage in Thailand. So one of Dr. Srawut's slide he showed the Thailand health infrastructure, and you might have seen that he showed the province, district, and sub-district. And in the sub-district level, they comprises of lots of health centers that distributed in around the country, almost 10,000 health centers, and that work closely in the community to identify and assess if they found pregnant women. They would invite them to come for antenatal care. And the uniqueness of Thailand is that we have a very strong maternal and child health service and system and referral network. And as you can see from his slide, more than 98% of deliveries are in healthcare facilities. Therefore, and the package of HIV and syphilis testing are integrated within the maternal child health package free of charge that would be able to help increase the coverage of testing. For community healthcare workers, each hospital in their HIV clinic, they have like few people here, people living with HIV/AIDS that work closely with the government staff to provide and then help support patients in the clinic. But in terms of, because Thailand, since there is kinds of culture in Thailand that they would come to for antenatal care, so therefore mainly most patients walk into the hospitals. And in terms of antiretroviral adherence, currently we are developing lots of programs for differentiated care like task sharing and task shifting from healthcare workers, and to give more roles for community people to help for differentiated care and to help support the service with their treat for all with high workload. Yeah, but it's ongoing process.
Thank you, Dr. Rangsima. And just a clarification from one of our participants, are the community health workers employees of the government health system? It seems like you were suggesting that they're not part of they're not a formalized cadre, but...
Yeah, but they were hired using special funds from National Health Security Office or special projects. But currently, we're working towards to promote the technical assistant platform. The Thai Red Cross is developing capacity building platform, technical assistant platform to train these peer community health workers with many multiple sessions. We are working on that, and to find the system and to fund them using the National Health Security, National AIDS Program funding that can support their salary and things like that, but it's in development.
Okay. Okay, great. Thank you. And there's another question regarding what role does do private service providers play? How did you bring or make them participate in efforts towards achieving EMTCT of HIV and syphilis? And what was their initial response and cooperation? And I think this is a very important question because many countries are grappling with how to work with and incorporate the private sector into the effort towards achieving these goals. So for Dr. Sarawat or Dr. Rangsima, if either of you or both of you want to take on the question, please.
Yes, for private service providers, when we look at the data of delivery in Thailand, majority of delivery occur in the public hospitals, but about 10% occur in private services, particularly in Bangkok and tourist provinces in Thailand. In terms of participating in the program, they were invited to join trainings. For example, they might join the training, PMTCT training that organized by many organizers in the country. For example, from Thai AIDS Society or the Pediatric Infectious Disease Society of Thailand or the OBGYN obstetric gynecologist training. So they had, and that linked to their our CME or medical education, continuing medical education credits. So they have required to get all these kinds of credits. And in terms of our service delivery, we have the system that's called Hospital Accreditation System. For the Hospital Accreditation Institute, all hospitals in Thailand, they want to achieve the requirements to get the accreditation from the Hospital Accreditation Institute to show that they have good quality of care. And therefore, private service also tie with this system. So they want to provide good service, including the maternal child health care service. And they have lots of key performance indicators that related to maternal and child health indicators. That's why they participate very well with the PMTCT program. But in terms of the validation process and to get data from them, as Dr. Sarut showed in his presentation, that it's very difficult in order to ask them to enter data into the national PMTCT monitoring system, since they're not under the government sectors. So therefore, we use the techniques of conducted a survey to send out survey to 170 hospitals, but the response rate was quite low. But anyway, we can find that the performance of service were quite similar to public hospitals.
Okay, thank you. Dr. Sarwat, would you like to add anything?
For the private hospital collaboration with the Ministry of the Public Health, in the community or in the regions, we have the MCH board. MCH board is compound the government and the private hospital to work together. And if we found the HIV positive in private hospital, and all of them can support the data in the MCH board for conference and for give ARV. But it is in important role for the MCH board in the regions, I think so.
Okay, thank you. So I'll open it up for any last questions or comments. And if any of the partners from Thailand want to add anything or expand on any of the points that were discussed, feel free to share your thoughts. Okay. If there are no more questions, I would just like to again extend our appreciation and gratitude to Dr. Sarawat, Dr. Ransima, and all of the other partners in Thailand who work to organize this webinar and share your experiences with us. And I also turn it over to the team in Thailand for any last words before we share a video. And Dr. Bina, if you wanted to give some background about the video as I load it, that would be great as well. So if there are any last words from the team in Thailand or any other partners or participants.
So I just would like to add that in Thailand, the Bureau of AIDS, TB, and STI are with and their Department of Health and our many partners in Thailand are plans to organize our training course related to eliminate the validation process preparation. And that's in the planning process. We are working on curriculum development. And the center that will conduct training is the international training centers that under the Bureau of AIDS, TB, and STI Department of Disease Control. Yeah, that's another option for countries who are interested to learn more about the validation process of the EMTCT in Thailand.
Okay, great. We will definitely follow up perhaps to obtain that information so we can share it with our community of practitioners and share it with all of those who joined us on the webinar today, if that would be okay. And we also recorded the webinar and with your permission would share the presentation as well for those who, due to conflicts in schedules or time, could not make it today. As I'm sure that there's a lot of interest in really understanding the ingredients to Thailand's success. And so if you give us a couple of minutes, even seconds even, we'll load a video that really shows the human side of Thailand's journey and process towards achieving elimination of mother-to-child transmission of HIV and syphilis. Dr. Beener, would you like to add anything?
Thank you, Jessica. Yeah, the video is self-explanatory, so I don't need to give an introduction to that, but this is, as you rightly said, a quick journey we tried capturing during our process of the elimination validation. So this we were using it actually for other partners who were actively involved in the elimination journey to also feel proud about, yes, they have done it. So this is an essence of what Thailand did. Thank you.
Okay, thank you. Just a quick, is the video showing? Is the video showing? So I hope that everyone could see it or hear it. If not, we will distribute it as part of the package of materials that we distribute after the webinar. Okay, so apologies for any technical difficulties with the video, but we will definitely send the link around. As we said, it really shows the human side of Thailand's experience in achieving the elimination of mother-child transmission of HIV and syphilis. I'll turn it over to Dr. Beener. Do you want to say any last words or acknowledgments?
Thank you so much. Thank you, Dr. Serawat and Ransima, for joining from different parts of the city. It's not easy in the morning traffic. And thank you, Jessica and team, for organizing it. Thank you, all the participants. In case you have any questions, please feel free to write to us. We would be happy to share more information, our learning, and the whole process. Also how Thailand reached the stage. So we will be happy to share from our end in case you need any help and if any of the countries are going towards validation process. Thank you so much. Thank you for joining. Thank you, Jessica.
Thank you, Dr. Sarawat and the Ministry of Health in Thailand for preparing this presentation, to Dr. Bina for organizing the webinar, and to all of you for joining us from wherever you are, from many different time zones at many different times during the day. And we encourage you to share all of these materials with your colleagues. And thank you to the team from Sri Lanka who joined us, and hopefully this information will be very useful to you. Thanks again, and stay tuned for more announcements about our future webinars. Thank you.